Thank you for joining me. Today I have a guest who is an expert in global health. He will be telling us more information about global health related programs. You can introduce yourself.
Yeah, thank you so much. My name is Sengimana Jean-Pierre. I'm a student at Southern New Hampshire University in the Faculty of Healthcare Management, concentration with global perspective. Thank you.
Yeah, it's a great pleasure to have you. Now, let me ask you some questions that I have here. Now, global health seems to be in the news more and more in the recent years. Talk about what global health is and why it is important to pay attention to it.
Yeah, thank you so much. Global health is an area of study and research that places priority on the development of health and achieving equity to all people in the world. We have to pay attention on global health. This is because everybody in the world is concerned on the global health. Thank you.
Okay, thank you. Disease can come to us in different ways. Now, explain the difference between communicable and non-communicable disease.
Well, I always start with communicable disease. Communicable disease are those diseases that can be contaminated from one person to another. For example, HIV, hepatitis, tuberculosis. The non-communicable disease are those diseases that are not transmitted from one person to another. For example, there is cardiovascular disease, diabetes. Yeah, there are many non-communicable diseases. Thank you.
Did you talk about communicable diseases?
Yes, I have said that communicable disease are those diseases that are transmitted from one person to another. The communicable disease are an example. There is HIV, there is hepatitis, and there are many communicable diseases.
Okay, thank you. Now, let's talk about Ebola. Since I'm sure most of our viewers have heard a lot about that, what is it? Is it a communicable or a non-communicable? How do people get it?
Thank you so much. Ebola is a communicable disease. It can be transmitted from one person to another. Ebola is a virus that causes severe bleeding, and it can even cause the death to the people. Thank you.
Okay, thank you. The next question. What would raise a person's risk of getting Ebola?
Thank you. There are many things that can raise the people to be affected by Ebola. There are some risks such as having contact with someone who is diagnosed by Ebola. Also, even touching on the thing that let's take an example. If I have phone, if I'm affected by Ebola and I have phone and I lend you that phone after using it, you can also be affected by Ebola. Even traveling in the place that you know there is Ebola, it can even raise the risk of being affected by Ebola. Thank you.
Okay, thank you. Now, the next question. So, to prevent at least lessen the chance of getting Ebola, what should people do?
Thank you. To prevent being affected by Ebola, as I have mentioned it, you have to avoid the contact with someone who is affected. Also, you have to have to stop traveling from your place to the place which has the Ebola cases. Thank you.
Okay, thank you. Now, outbreaks such as the one related to Ebola can generate a lot of rumors and misinformation and even panic about what the disease is, how it is transmitted, and how likely people are to get it. Talk about the need for educating people about facts versus myth.
Thank you so much. The first thing, if you want to do something for the people, you have for the first one you have to educate them. You have to teach them. You have to explain for them what is Ebola, how Ebola can be transmitted, what are the effects of Ebola. This will overcome the myths of the people about Ebola. Thank you.
Okay, thank you. Then the next question, how about the complications that Ebola raises for the rights of travelers and the responsibilities of governments? Catch Hickox, for example, a nurse from Maine who returned to the state following a trip to West Africa in the fall of 2014, promptly had quarantine-related restrictions thrust upon her, restrictions that she was very much against. Briefly describe the difficulty of balancing individual rights and government responsibility.
So, balancing the individual rights and the government responsibility, the government should teach those people who are traveling in the places that where there is the Ebola case. They have to explain those people that Ebola is a serious virus. Ebola is a disease that is rapidly spreading in the people. The government should tell those people that they have to know, they have to teach them more things about Ebola and the effect of visiting those places that has the risk of Ebola. So the government should help those people to understand the reason why they are staying in quarantines. Thank you.
Okay, thank you. Now, let's talk about smoking and tobacco use, which is considered a big world health problem and raises similar issues to Ebola in terms of rights and responsibilities. Just about everyone knows that smoking harms health. What does it to the body?
Thank you. The smoking is the thing that is affecting more people in the world. It is killing many people in the world. So about the effect, the smoking can damage the heart. It can cause the cardiovascular disease. The smokes, when you are smoking, that smoke can break the blood vessels, and then finally you will find people suffering from stroke. Thank you.
Okay, thank you. Now, what about secondhand smoke? Explain what it is and how it affects people.
Thank you so much. Second-hand smoke, it's a combination of smokes from the burning of ending of cigarettes, and there's the smokes breathed out by the smokers. It contains 7,000 chemicals that are very harmful to people's lives. In the United States, every year 37,000 of people are dying because of second-hand smoke. Also, second-hand smoke is rising the problems in the people. People are being affected by heart attack. People are being affected by the lung cancers. That is why the second-hand smoke is very harmful. Those people are not smoking, are the victims. That is the effect of the second-hand smoke.
Okay, thank you. Now, the next question. People don't typically think tobacco as a drug like heroin or cocaine, but the addiction it creates is strong, isn't it?
Yeah.
So, should we think of tobacco use as a form of substance abuse?
tobacco should be in the form of abuse, the abused smoking and drugs. It can even if we don't take it as we take marijuana, tobacco is very harming people's lives. Even it is even polluting the air. Those people who are smoking are very suffering. At the end they suffer from heart disease. At the end they also suffer from lung cancers. Even those people who are not smoking are being affected by the tobacco. That is why on my side I think that smoking tobacco should be prohibited, should be avoided. Thank you.
Okay, thank you for talking to us.
Thank you so much.